Welcome to this informational video on individual enrollment in the Home Clinic portal, the system used by home clinics in Manitoba to manage patient enrollment. This video will explain how to use the Home Clinic portal to search a client, add a client, enroll a client, and associate a most responsible provider, otherwise known as a main primary care provider. All active home clinics are eligible to submit an initial bulk enrollment using the Primary Care Data Extract, or PCDE. If you are currently using the enrollment service to submit your enrollments, the scenarios we will outline here do not apply, and you will continue using the enrollment service. There are scenarios in which the PCDE will not support client enrollment, and the Home Clinic portal must be used. Some examples are: a client has not had an appointment at the home clinic in over 5 years, a client has a most responsible provider that is associated to more than one home clinic on the same shared EMR, or a client is enrolled to a home clinic but does not have a most responsible provider. In these scenarios, the PCDE does not contain enough information to determine which home clinic the client should be enrolled to. If your home clinic is eligible to use the PCDE only for a one-time initial bulk enrollment, you will complete all ongoing enrollment in the Home Clinic portal. This includes new client enrollments. If your home clinic is eligible to use a PCDE for ongoing enrollment, you may also want to complete individual entry to add a client enrollment in between PCDE submissions. Start by logging into the Home Clinic portal with your Shared Health user ID and password. After reading the confidentiality statement, click OK to acknowledge acceptance. Select the Client Enrollment option from the menu bar at the top of the home page. You will then be presented with the Search Client screen to see if they exist in the database. Enter as much client demographic data that you have available, including a middle name or initial. Other useful identifiers could be out-of-province health numbers, veterans numbers, treaty numbers, or Canadian Armed Forces numbers. Select Search to see if the client exists. If the client exists in the database, client matches will be displayed. The client name will display unknown unknown if the client record was received through the PCDE. Find the correct client and select the row to view the client details. If the client does not exist, you will need to select the Add button. Remember that until enrollment data is received, searching a client could result in no returns. To add a client, enter all the appropriate demographics, including a patient identifier, and click Save. Required fields will be indicated by an asterisk. Selecting Save will add the client to the provincial enrollment system, providing the ability to then individually enroll them to your home clinic. The Enrollment Wizard in the Home Clinic portal will guide you through the enrollment process. Click the Enrollment Wizard button in the Client Details window to start. The Enrollment Wizard will display the possible enrollment-related actions on the left-hand side of the screen. This list will change dynamically based on the conditions associated with the client being viewed. The right-hand screen will display the applicable client details. To enroll a client, select Add Enrollment. Next, select your home clinic and enter the enrollment start date. We suggest using the calendar to reduce data entry errors. Next, indicate the enrollment method. When selecting passive enrollment, enter the date that you are enrolling the client in the Home Clinic portal. Note this may be different from the passive enrollment start date you entered in your EMR if you use the date 01/01/1899. When selecting active enrollment, enter the enrollment start date recorded in your EMR. Once you've completed all fields, select Save. If you accidentally enrolled the client actively but meant to indicate passive enrollment, contact the Home Clinic team for a correction. As enrollment is now complete, you will be asked if you would like to associate a most responsible provider from your home clinic to the client. Select Add MRP. Select an MRP from the list provided. This list will only contain providers who are currently associated to the home clinic shown. Enter the start date, then select Save. If you are associating an MRP at the same time as initial enrollment, enter the same start date as the enrollment start date. If this is not an initial enrollment, and you are now associating the MRP, enter the date the provider was associated to the enrolled client. This will not affect the initial enrollment start date, which will remain unchanged. More instructions on how to use the Home Clinic portal can be found on our website in the Home Clinic portal user guide. For additional support, contact your assigned Home Clinic liaison or the Home Clinic team using the information provided. Thank you for watching.